Dear students, this is Professor Eman Ahmed Zaky, Professor of General Pediatrics and Developmental and Behavioral Pediatrics, and the head of the Pediatric Neuropsychiatry Unit. Today I will discuss normal development with you. I would like to declare no conflict of interest. Intended learning outcomes of my lecture include: let you understand what is typical development and its stages, to recognize factors affecting normal development, to have the ability to identify different categories of developmental milestones, and to understand how to assess developmental milestones and have the ability to conduct such assessment. What is normal development? Development of an infant, a toddler, and a child is a process by which they, as they grow, learn and acquire more refined gross and fine motor and social skills. Reflexes that initially developed to help and support survival become integrated into more refined movements as the child matures. Children tend to acquire such skills in an orderly pattern and within certain age ranges, the so-called typical or normal development, which is used to monitor their developmental progress. In some cases, late acquisition of these milestones can indicate developmental delay. However, it should be kept in mind that the acquisition of such milestones has a range of normality which could be wide. Some children may skip a milestone altogether, especially as crawling. What about factors that influence development? Development is a process which is multifactorial in nature, in which both genetic and environmental factors interact to result in a special pattern of developmental profile. Genetic factors are polygenic, that is to say, many genes are involved, each of which play a role in the outcome picture of the development of a special child or an individual. Even environmental factors also are multifaceted. They could be biological, they could be social or psychological. What about the causes of developmental delay? There are many causes that can delay the development of a child. They include events that precede conception, or factors and causes that may alter the development of a child or an infant during his intrauterine life, or at birth, or the period that follow birth. They include prematurity, they could be idiopathic, they include long postnatal hospitalization, maternal deprivation, maternal mental health status, intellectual disability, specific handicaps, including motor, sensory, and multiple. The development of special senses, including taste, smell, hearing, vision, and touch, are very crucial for normal development to occur. The attachment of the infant or toddler to his primary caregiver, which is usually the mother, will determine the security of the child in his future life. If it is healthy and secure, the child most likely will acquire a healthy mental status. If it is the reverse will occur as well. The development of attachment is categorized into age ranges. It starts from birth to 3 months, then from 3 months to 8, from 8 months to 12 months, and then from 12 months onward. During the period from birth to 3 months, the baby recognizes his mother's voice and smell, responds to humans in general, and can signal his emotional status to adults in the form of crying and smiling. The caregiver, which is usually the mother, her actions will set and maintain the context for the development of the attachment and the attachment bond. The baby initiates interaction with the attachment figure during the period of, from 3 months to 8 months. He learns to differentiate between important adults. He continues to accumulate and internalize interactive experiences with the attachment figure. During the period from 8 months to 1 year, the baby moves differentially to the attachment figure for comfort when he feels distressed. He will become able to explore using the attachment figure for security. He clings to the attachment figure when he is distressed. He cannot be comforted by an unfamiliar adult. From 1 year onward, the type of attachment depends on the sum of caregiving experiences from birth. Caregiving varies according to the sensitivity of the parent. Most 1-year-old infants have worked out an organized way to behave in the attachment relationship. The child development is a journey. That journey stops at many stations, and the child by its end will reach his final destination. We will discuss the child developmental journey in part 2 of my lecture. Till we meet again, this is goodbye. Hi once more, my dear students. This is the second part of my lecture about normal development. With you is Professor Eman Ahmed Zaky, the head of the Pediatric Neuropsychiatry Unit, Department of Pediatrics, Faculty of Medicine in Shams University. Declare once more, no conflict of interest. The intended learning outcomes of this part of the lecture include to let you be able to recognize the different categorical developmental milestones and to identify the detailed sequences of events of each category of developmental milestones. The different categories of developmental milestones include gross motor, visual and fine motor, hearing and language, and lastly, but by no means least, personal and social milestones. This diagram shows that developmental milestones act like a symphony, integrating all the milestones together to give the final outcome profile of the developmental pattern of any child or an individual. They include the gross motor and fine motor, which interact with the visual spatial abilities of an individual, They include language development, which depends on hearing, and nonverbal communication together with the language will give the social abilities of any child. Then we have the cognitive abilities, the self-care abilities, and lastly, the sphincteric control ability. The development of a child is a journey. Uh, it has many stops, and at last it will reach its final destination when the child reaches his adolescence. We can divide the developmental milestones according to the age of the child into the following. At birth, the child will start to form his ability to focus for a distance, and he will shape his preferences. At the age of 6 to 8 weeks, he will smile to maternal overtures, he will fix and follows, and he will be able to change his position from prone to ventral, and at the prone position, he will have his pelvis flat and his hips extended. While in the ventral position, he will hold his head up briefly. At the age of 3 months, he will hold his head up for a longer period, and he can wave goodbye. He will contact his parents or caregivers, and he will hold a rattle in his hand, turning to the sound ear level. At the age of 4 to 5 months, he will be able to reach out for objects. At the age of 6 months, he will transfer hand to hand. He will show, babble, sit with hands forward, and lift his head spontaneously from the supine position. At the age of 10 months, he will make the index finger approach, and he will be able to make the finger thumb opposition and wave bye-bye easy. At the age of 13 months, he will cast objects, walk without support, and he can pronounce single words. At the age of 15 months, he will feed himself from a cup, and he will imitate all the household adults. At the age of 18 months, he will cast stops, he will make a tower of 3 cubes, he will walk well and scribble. At the age of 2 years, he will join 2 or 3 words to form a phrase or a sentence. He will pronounce about 50 words, run well, climbs, and ascend or descend downstairs, and he will make a tower of 6 to 7 cubes. At the age of 3 years, he will be mainly dry by day, with or without dryness at night. He will be able to dress himself and undress fully. He will climb upstairs and downstairs. He will alternate feet and ride a tricycle. These tables will show you the details of all developmental milestones, and they will be left for your abilities to self-learn. They will include the developmental milestones of gross motor, fine motor, speech and language, and social domains. Now, it is the time to end the second part of my lecture, and looking forward to seeing you in the third part of my lecture. Thank you. Hi, once more, my dear students. This is the final part of my lecture about normal development. With you is Professor Eman Ahmed Zaky, the head of Pediatric Neuropsychiatry Unit, Pediatric Department, Ain Shams University Faculty of Medicine. For the last time, I declare no conflict of interest. What about the intended learning outcomes of this third part of my lecture? To recognize factors that influence childhood development, to recognize the developmental delay warning signs, and to know the available interventional modalities for cases with developmental delay. What about developmental warning signs? They include maternal or parental concern because of delayed acquisition of some developmental milestones or all of them. They include also persistence of primitive reflexes, discordance of developmental abilities in different areas, and regression of previously acquired skills. Assessment of development is essential. Why? Because they are useful to evaluate the current skills of a young child relative to where they should be. They are essential to identify the high risk for a specific problem from those with global developmental delay. Picking up cases for available, selective, and effective interventions. At school age, it can highlight neurodevelopmental strengths and weaknesses crucial for academic learning. So, we need to do a rapid child surveillance to detect if he is normal or needs thorough assessment. This surveillance concentrate on head control and posture during neonatal period, the ability to use the supine position at 6 to 8 weeks, to sit at the age of 6 to 9 months, the mobility of the toddler during the period of 18 months to 24 months, the ability of the child to communicate at the age of 3 to 4 years. History taking is a crucial cornerstone in assessment. They must lay stress on parental concerns, antenatal, natal, and postnatal events, whether normal or hazardous, family history relevant to development, social history, the intake of any medications, operations, and the presence of any allergies. Developmental history will concentrate on key milestones, temperament and behavior of the child, sleep pattern, eating habits, sphincteric control, concerns in nursery, if any, and previous developmental checks and relevant concerns. Second step is clinical assessments that include thorough observation, engagement with the child in a comfortable, friendly environment with proper safe toys to attract his attention. The room must be prepared to be safe and comfortable, where the examiner faces the caregiver and his eyes are on the child to observe him without irritating him. Establishment of a rapport between the examiner and the caregiver and the child is essential. Also, interaction will depend on the child's age and pattern of behavior. We must make the child feel safe and enjoy the task. The detailed developmental assessment of 1 or 4 key developmental milestones must be carried out. At the end of our assessment, sometimes we will not be able to satisfy the mother. Some mothers will be very reluctant to accept that their children are normal. And on the other extreme, Some mothers will be shocked if you tell her that her child have her child has a problem. So satisfaction of our customers is usually difficult. Questions are guaranteed in life, but unfortunately answers are not. Take home message from my lecture include the ability of the listener to recognize that acquisition of developmental milestones has a range of normality, and the relevance of developmental delay varies from a child to another. Lastly, but by no means least, you must be able to recognize the developmental delay as early as possible. Because early detection of such developmental delay is essential for early and maximum intervention and for parental acceptance, as well as the most desirable prognosis of any case of developmental delay. Let me thank you for your attention, and I hope you will enjoy your journey in the pediatric curriculum and get the utmost benefit of your clinical rounds, as well as the lectures from the best professors in each subspecialty of pediatrics. Let me now wish you the best of luck.